Welcome to Blue Briefing. Our video will look at an important paper in the American Journal of Respiratory and Critical Care Medicine. Here we discuss temporal transitions of the hyperinflammatory and hypoinflammatory phenotypes in critical illness by researchers from the United States and Netherlands. Changes in inflammatory biomarkers are key indicators of prognosis and treatment response in critical illnesses like sepsis and acute respiratory distress syndrome. However, the temporal dynamics in systemic molecular phenotypes of critically ill patients and their prognostic implications have not been explored. An international team of researchers aimed to assess the impact of temporal changes in inflammatory phenotypes on the outcomes of critically ill patients. They analyzed the data of 2,407, 527, and 868 critically ill patients from the MARS, alveoli, and Clover's clinical studies, respectively. Molecular phenotypes were classified as hyperinflammatory or hypoinflammatory using a validated biomarker model based on plasma interleukin-8, protein C, and serum bicarbonate levels. At the time of admission, that is, day 0, 36.0%, 26.4%, and 24.8% of patients in the MARS, alveoli, and Clover's cohorts, respectively, were classified as hyperinflammatory. In the MARS cohort, the proportion of hyperinflammatory patients declined to 15.6% by day 2 and 6.3% by day 4. Similarly, in the alveoli and Clover's cohorts, the proportion of hyperinflammatory patients decreased to 13.4% and 5.7% on day 3, respectively. Notably, the transition from hyperinflammatory to hypoinflammatory phenotype, as shown by the light blue lines, was associated with significantly lower 90-day all-cause mortality compared to persistent hyperinflammation, as designated by the red lines. Further, the observed effect was largely independent of improvement in organ dysfunction, suggesting other causal mechanisms. Overall, these findings suggest that transitioning from a hyperinflammatory to a hypoinflammatory phenotype is associated with improvements in recovery and survival. Therapeutic interventions targeted towards mechanisms besides improving organ function can optimize the treatment of critically ill patients. However, these data suggest that interventions to promote switching from hyperinflammation to hypoinflammation have a very small window of opportunity for recruitment, probably limited to within 24 to 48 hours of ICU admission. Finally, these hyperinflammatory biomarkers may help guide goals of care discussions, particularly if they remain elevated by days 3 to 5. For more details, please read the article by Dr. Van Amstel and colleagues. Thank you for watching Blue Briefing.